Good morning, good afternoon, everyone. Welcome to, my name is Terry Goodtrack. I'm the President and CEO of AFOA Canada. I wanted to welcome all AFOA members and our future members, prospective members, to our third live webinar series, the Evolving Indigenous Workplace, Defining a New Normal, where we're sharing resources and information that can help you navigate through the ever-changing events here around COVID-19. You know, last couple of weeks, what we did was we focused essentially on financial management. We looked at the programs that were available to communities and mainstream Canadians. We want to thank First Nations Bank for doing that. In the second series, we looked at the accounting for those expenditures, and we certainly want to thank MNP for stepping up and doing that. Now we're kind of shifting gears, and we're starting to take a look at human resource management, sort of the human element. As we all know, we're very, all of us have those types of responsibilities, and as the offices are soon to open in the future, you know, we certainly want to make sure that we're conscious of a healthy and safe workplace. If you have any questions during the presentation, add them to the Q&A window. There will be a 15 to 20 minute Q&A session at the end of the presentation. And there will also be polling questions throughout the webinar. So please, submit your answers when we do the polls. It's very interactive. Today, our presentation is Returning to the Workplace, Health and Safety, and our presenter is from Boreal Management, Tanya Neitzert. Tanya is one of the lead partners at Boreal Management, an HR consultancy with a specialization in supporting Indigenous organizations to build capacity through their people. Tanya is an HR professional with 20 years of experience in the field. Prior to moving into consulting, she led HR teams in the technology, sales, education, and manufacturing sectors for companies of all sizes, ranging from startups to large organizations. Since 2016, Tanya has worked almost exclusively with First Nation clients, supporting the human resource teams in First Nations health, education, and local government. Tanya holds a BA from Concordia University, a certificate in human resources from McGill University, and is a certified human resources professional since 2004. She is also an accredited facilitator and certified change management practitioner. She is co-author of the book HR Manager's Guide to Employment Files and Information Management, Legislation and Best Practices. Most recently, Tanya has been involved in crisis management with many First Nation clients in relation to managing their response to the COVID-19 situation and helping them plan suitable HR strategy for now and the future. She is very happy to join us today to offer valuable insights on how you can plan for the eventual safe return to the workplace for your members and your employees. She will also be joining us next week for a question and answer session to share some of the issues she has been hearing from clients and respond to your HR questions and concerns. Please help me welcome Tanya Neitzert. Tanya, over to you.
Thanks so much, Terry. And welcome everyone. I'm really looking forward to taking on this webinar today. Just before we begin, I wanted to also welcome Lila Bussiere, who's one of our fantastic consultants at Boreal Management. So Lila will be answering the chat as we go through, so do feel free, hi Lila, do feel free to ask those questions using the chat feature throughout the webinar. And Lila is also going to join me at the end to answer the Q&A. So feel free to ask your questions during the webinar, but also you can hold them till the end if you prefer. So we're looking forward to hearing you from that. So before we begin, I wanted to tell you a little bit about Boreala, just so that you had an understanding of who we are. So Boreal Management is a consulting firm headquartered in Montreal, but we support clients across Canada in human resources, as Terry mentioned. So as part of human resources, we cover 6 service lines, and these are strategy, culture, and team engagement, organizational effectiveness and governance, human resources fundamentals, talent management, compensation, and organizational transformation and change management. So we work with clients in all industries, including Indigenous governments and organizations, band councils, school commissions, health boards, and private sector companies. And our goal is to build capacity through people, as Terry did already mention. One of the areas that we specialize in is in health and safety, which it falls under our human resources fundamentals categories, and also workforce planning. And so these are two topics that we'll be really covering today as we talk about your return to work, your safe return to work plan. So let's begin. So as part of our webinars today, we've created a checklist that is available to all of you, actually. And these are 11 steps to a safe return. So we're going to go through each one of these steps today as part of the webinar. But if you are interested in receiving a copy of the checklist, just hang on till the end and we'll explain how you can get a hold of that. So we will be going through each one of these steps today. And then that'll be really the meat of our webinar today. So the first step, if we're thinking about returning to work safely, is really to know your obligations. And so really the fundamental thing that you'll need to do, and if there's one thing I can really advise you to do, is to go to your local legislation, your occupational health and safety website. Each province across Canada, as well as federally legislated organizations, will have slightly different rules and requirements. But this would really be the starting point of where you'd want to go to identify what your requirements are upon your return to work. And within that, within your occupational health and safety, there are going to be a series of elements that you will really need to do to ensure that you provide a safe. So the purpose of the occupational health and safety is to identify and control and minimize risks, and to ensure that you provide a health and safety workplace for your employees. So this is your obligation as an employer. And so as part of this, you will need to develop a health and safety policy based on COVID-19. So we will talk in a little while about specifically how to create that health and safety policy, but you need to know that that is one of your obligations. You'll also have to inform and train your employees in these new procedures. So any new procedures that you'll need to implement, you'll need to inform and train your employees on them. Employees also have obligations with respect to health and safety requirements. So you'll have to both share those obligations to your employees, but be aware as well, know what those employee obligations are. So ultimately, your employees also have a role to play in prevention and managing risk, and they need to comply with the rules of ensuring a safe environment. There are fines for non-compliance. So again, it's extremely important for you to be aware of both what those requirements are as well as what the fines are, so that you know exactly what could happen in case you were not compliant. And finally, there are many other legal obligations to consider as well. We are focusing today on the health and safety component, but do be aware that there are some additional legislation that you should be aware of that are connected. So for example, the right of refusal to work is an element that you'll need to understand. So if your workplace is not up to safety standards, your employees could refuse to work legitimately, and you'd have to pay for the time that it takes to get it up to speed. So that is something you should be aware of. In addition, you should be aware of human rights legislation generally. And we'll talk a little bit about this a little bit later on, how it can relate specifically to occupational health and safety, but it is important that you're aware of this, as well as other standards, employee standards legislation. So again, based on your jurisdiction, you will need to know, for instance, what kind of leave are you obliged to provide employees under certain circumstances. So really important to know your obligations as a starting point for for a health and safety recovery. Another important thing to do as you go through this is really to stay informed. So, there are public health guidelines that I'm sure you've seen, but these public health guidelines will be critical for you to be aware of. They change very frequently, as you know, and they will need to be part of your health and safety policy. So do keep yourself abreast of those. Also know your industry specific guidelines. So for instance, depending on if you're in the manufacturing sector, if you're in retail, the rules are different. And so you need to know what those rules are that are specific to your industry. It can be really helpful as well to pay attention to the best practices of organizations similar to your own. So, build off of each other and and don't be shy to consider what others are doing so that you can make sure that you're creating the conditions for a great recovery. I think everyone is keeping informed with the news, but do make sure that you keep informed, keep up with the news. It changes so frequently right now. You know, yesterday, Justin Trudeau came out with, you know, new sort of guidelines about wearing masks, and each day there's something new. So do be aware of all of those changes. It's also a good recommendation to review your emergency measures plan and to stay informed about how that can impact the planning for your recovery. So don't kind of, and we'll talk about additional policies a little bit later, but do bear in mind some of the other aspects that you have in place already. And a really important aspect is to conduct a workplace risk assessment. So be informed about how to conduct a workplace risk assessment, because it'll be the starting point really to identifying how you're going to develop your health and safety policy. So these are all important areas that you should be aware of before sort of embarking on this plan. So the health and safety policy, and we want to spend some time here because it is really important for you to really make sure you're managing carefully. So the first step is to collaborate with your health and safety committee and your union. So every organization you may or may not have a health and safety committee, and you may or may not have a union, but if you do, it's really advised that you would, or not even advised, it's essential that you collaborate with them so that you make sure that the important parties or the relevant parties are included in the planning. If you don't have a health and safety committee or a union, it's also advised to potentially create a collaborative group of employees so that you can ensure to have participation from your employees generally in this process. Sorry, there we go. Identifying the workplace exclusion requirements is another really important aspect, is a critical, sort of foundational to this policy. So the workplace exclusion is who are you going to, not allow into the building, from an employee perspective, who's not allowed to come into work. And these are, generally speaking, there are three main categories of employees that cannot and are legally not able to present themselves into the workplace. So these are people who show symptoms of COVID. And so this is where you keep up with your public health and safety, public health guidelines to know what those symptoms are, because they have changed a little bit. For instance, the odor, the sense of odor now, but also, people who have colds, fevers, etc. So those people would be excluded from coming into the workplace. Anybody who's been in contact with COVID, so that is either, if they actually have COVID themselves, they're certainly not allowed in the workplace, but even if they've been exposed to COVID, so if somebody that they're in contact with has developed COVID, they would not be eligible to present themselves into the workplace. And also anybody who's been traveling needs to quarantine for 14 days, as you likely know. So again, those are the three exclusion requirements that are currently being considered as part of your exclusion for health and safety. You'll also want to identify and define who the vulnerable population is. So again, this is where there is some leeway for the employer to identify following the public health or the public health guidelines. So for instance, those over 70, those with certain health conditions, you may wish to inform them that they do not need to come into the office, or you may want to actually choose that they won't come into the office. You have some leeway in terms of how you handle the vulnerable population, but it needs to be included in your health and safety policy. So it's something to keep in mind as you proceed. Another requirement based on the health and safety legislation is to validate your employee health status as they present themselves each day into the office or into the workspace. So this could be, for instance, a questionnaire that could be provided that would ask those same three questions that I mentioned before. So do they have any symptoms of COVID? Have they been in contact, or do they have COVID? Or have they been in contact, and have they been traveling? And so if that's the case, you would need to ask those, so then you would need to exclude them. So you'd have to ask the questionnaire each day. And you'll also need to log the fact that you did that questionnaire and the responses. So you'll need to implement a process to validating the health. Some people are There have been some recommendations about taking temperature as well. There is no requirement to take temperature. However, and moreover, you would need somebody trained if you wanted to take temperature. So again, this is something that may be more of an industry-specific suggestion or an industry-specific consideration, but not necessarily a recommendation or a requirement. So if you are thinking about temperatures, that's something you'll want to check into. Handling workplace illness. So as part of your health and safety policy, you'll need to identify what you're going to do with people who become ill. So if somebody does present symptoms in the middle of the day, so now you've gone ahead and you've asked them to do their questionnaire in the morning and they were fine, but all of a sudden they start, to sneeze or get some symptoms, you'll have to have a policy. And the recommendation is that they immediately isolate within the building. And there's a process to making sure that they leave the building, but immediately isolate while they're transitioning to leave. You'll have to ensure that all of the areas that they've been in contact with are disinfected immediately. And you may also need to validate who has been in contact with them and have a procedure set up for that as well. So do include in your policy how to handle those workplace illnesses. The use of personal protective equipment is one that has been widely debated, and I think that debate is going to continue. So again, keep up with the news on this one. But at the time of this presentation, and again, this will really depend on your industry and your type of business. But if your employees are going to be, or if there's any way that your employees will need to be, can't social or physically distance themselves, then you will probably be required to provide personal protective equipment. So whether or not you request or you insist on personal protective equipment will depend on certain factors. And one of them will be the proximity of the employees to one another. When they're close, you should include the personal protective equipment. When they're not going to be within those 2-meter distance, you may not be required to provide personal protective equipment, but again, this will be industry specific and will be, based on local jurisdiction and so on. So we recommend that you really continue to be vigilant about this particular aspect. Hygiene practices will also be a very fundamental component of your health and safety policy. We actually will be talking specifically about what to include in those hygiene practices and how to consider it, but both the employer and the employee will have obligations when it comes to hygiene practices, both in terms of, what to do, like how to wash hands and so on, but also what to disinfect in that procedure. So you will want to include that notion within your policy. And finally, reviewing how visitors will be received. So in some organizations, you may choose to, ban visits, for instance, or ban non-essential visits. So maybe you'll still be receiving your mail, but you won't have any in-person meetings with clients, for instance. This again will depend on the nature of your own organization. So you'll always need to think first about the nature of your own operations, but how will those visitors be treated? Will they be required to complete the questionnaire? You will have to validate the health status of your visitors as well. And speaking of how visitors will be received, you may also want to consider if your employees have to go to another work site as part of their business, will you require the confirmation of the health and safety policy of the person or the organization that your employee will be visiting? So it's another consideration you may wish to think about in there. One last point, I'm just checking my notes here, 2 last points, I guess. The first is that before you move forward with any of this, you may need to conduct an inspection. It's something we might come back to a little bit later on in the presentation, but something to bear in mind is conducting of an inspection. And also, that this is a temporary policy. So if you're writing a policy, it's always a good idea, especially in this context, to indicate that it is a temporary policy. In a moment, we're going to talk about other connected policies. And so it might really come up at that point. But it's helpful to remind employees that these are temporary measures so that you're not giving a whole new unconditional policy that's unchangeable. So it could be advisable just to mention that this is a temporary policy for a certain duration and come back to it over time. Okay. So as I mentioned, considering other policies is going to be an important component as you consider your return to work. So as you develop this COVID health and safety policy, you want to be thinking about the other policies that you currently have in place to really ensure that there's alignment and consistency. So for instance, I mentioned earlier that you may have an emergency measures policy or business continuity plan in place. So do check that. Maybe you've committed something to employees, so you'll want to make sure that there is an alignment there. Similarly, leave policies. So you'll want to validate what kind of leave policies are in place. So what are the procedures to taking leave? Some depending on your jurisdiction, some employment standards for leave have actually changed. In others, they've stayed the same, but you might choose to become more flexible with leave, perhaps unpaid leave, for example. So again, just check what your current policies say and make sure it's aligned with the spirit of what you're trying to achieve with a healthy return to work. Similarly, disciplinary policies. So we'd hope that you'd have a disciplinary policy in place. Validate against your disciplinary policy. Is it aligned with your health and safety policy? So if somebody is non-compliant with the health and safety policy, do you have a disciplinary policy in place that's appropriate for certain situations? And is that something you need to review with your HR team just to ensure that you're going to be able to enforce it appropriately? The medical note requirement is one that has been recommended that you waive. It's a bit challenging in the sense that on the one hand, if somebody is feeling ill, definitely you'll want to recommend that they stay home, or not just recommend, you're required to ensure that they stay home. But will they need a note? So they should be advised to go and get themselves tested. So anybody who has symptoms needs to be tested. But the question is, do they need to have a medical note to be authorized to return to the workplace? And this is one where there's no legislation or precedent that absolutely states the requirement. It's difficult. You can appreciate that with the overwhelming of the medical system, we'd like to reduce the amount of medical notes that are being requested, certainly for basic absences. But at the same time, if somebody does have COVID, it might be for the best to ensure that they're authorized to come back to work. So this one, keep up with the public health recommendations. At this moment, it's for the best to only require a note if absolutely necessary. And finally, considering other policies, consider your work from home and flex time policies. So you might want to lighten those up a little bit. Especially we'll talk a little bit about how you'll need to ensure that that flex time is adjusted for rotation of arriving at work. But those work from home policies might be reconsidered as well. And I mentioned earlier to consider it a temporary measure so that it doesn't become a permanent policy. You can consider it temporary, so during the time of COVID or during the pandemic, employees have much more flexibility to work from home, for example. All right, so workforce planning. So as you're coming back to the office, there's a few considerations here that you'll want to validate. So the first, again, considering your business environment, how many employees are actually allowed to come back to work? This is very industry specific and could be based on your jurisdiction, the jurisdiction that you're in. So how many employees will be allowed to work? How many employees are allowed in a certain workspace? So pay attention to that before you make plans. And how many employees are needed? So, you may be allowed to bring a certain number of employees back, but your business operations, just given the circumstances, you might not be able to bring everybody back. So consider those two factors before you actually make your plan about how people will return. It could also be advisable, this is certainly not a requirement, but could be advisable to survey your staff about their circumstances. So for instance, if you are only bringing certain employees back and not others, if you're going to kind of have a gradual return or a slow return, or depending on the circumstances, it might be helpful to survey employees to say, who has conditions that they either can't come to work or that they would prefer not to come to work. It's advisable as well to be very careful about planning who will come back to work. That can be, so that you're not doing anything that might be construed as discriminatory or that might bring about a constructive dismissal claim. So do just consider, have a very systematic approach to validating who you're going to bring back, so that you're not sort of picking people based on any factors that are not really well planned and organized. So have a plan in place there. continue to work from home. So all public health is recommending that where possible, employees work from home. So whoever can work from home should really do so as we go through this pandemic. And consider, the schedule to bringing people back. So both this is, firstly, in terms of a scheduled return, maybe some employees and then over time, more employees. But in addition, consider, your arrivals and departures in the building and avoiding, the use of space, common space. So you may want to have employees arriving on a different rotation. So a modified schedule so that you have less people in the building at any given moment. So staggered hours, for example, is something to consider in your workforce planning. Consider as well job sharing. It's an option if you're only able to bring a certain percentage of your employees back, you may want to have them share their work, for example. We'll talk about in a moment about protecting the equipment, but we'll get to that in a minute. The organization of the workspace itself is going to be a key element to making sure that your environment is safe for the employee's return. So one aspect there is the building entry. So I was mentioning about when people are coming into the office, you'll have to really consider, the type of building that you have. Are you in a shared building, or are you in a single? Are you the only one in the building? Your employer is the only one in the building. So if you're in a shared building, you may want to, or you really should be checking in with the building owners to validate if they have any rules or requirements. Are they going to put in rules about using the elevators? And elevators in and of itself is a really serious factor to consider, because there are certainly going to be rules about how many people are allowed in an elevator at once, which may impact, the time it takes employees to get into their office space. But if you are in a single building or without an elevator, for example, just to consider how many people can be in the waiting room or the lobby, or you're arriving at the door at one time. So put some kind of consideration to that. Obviously, the physical distancing is a critical component of all of this. So you'll need to make sure that you move workspaces apart where appropriate. So if you do have, if you're in a shared workspace environment or in an open concept, you may need to move workspaces apart, and so consider the physical distancing there between your employees. The use of common areas. So this is going to be a big consideration. So in our office, for example, we have a couch. So are we going to allow people to even use the couch? Or are we going to put limitations on the couch? That's a question, that you'll want to consider. So in those lounge areas in the kitchen, you'll probably want to move some chairs out so people aren't, able to sit closer than 2 meters apart. And even rotating the time that people, if you have typically employees will take lunch from 12 to 1, you may want to propose that, no more than, well, first of all, you should impose that there are no more than an X number within that space, depending on the size of those common areas. But that may require you to adjust the timing of lunch breaks and other types of breaks. So something as well to consider. Meeting rooms as well is something to consider. So you may want to remove the chairs out of the meeting rooms. You may wish to, just put up some regulations about how people can use common spaces like this. And don't forget your doors. And so there's a number of other recommendations as well. We put up a few tips for you to bear in mind. But for instance, with the doors, you may wish to put a door stopper under some doors, just so that people aren't having to use the handle. But in common meeting rooms, for instance, you may want to tape up, the latch, so that the door can be pushed open and closed instead of requiring people to use the handle. So these are some ideas to organize your workspace. Cleanliness and hygiene is really fundamental, again, to all of this. So putting in practice some really strong cleaning and hygiene rules will be important. So start off by reviewing the cleaning standards. So for those of you who have a cleaning service, I think that would be most employers would have a cleaning service. So check in with them. What are their procedures? Have they changed their procedures? Are there rules that you will need to adhere to so that they can do their work? You should maybe consider increasing the frequency and or the thoroughness of the cleaning, which may incur a cost, but you will want to review that with your service. And then providing cleaning supplies and requiring frequent disinfecting from your employees. So you may need them to clean their own equipment each day, or you should implement these types of considerations. Consider your common areas again. So no sharing of utensils. It's been recommended that you maybe, just have everyone bring in their own stuff. And you'll have to consider as well, what are you going to do about the fridges, the microwaves, the coffee, the milk in the fridge for the coffee, or is everybody going to have to wipe these down, or are you going to block access to it altogether? These are, individual situations. So it's something that you'll just need to consider all of the common areas that you have and how you're going to handle them. Frequent hand washing is obviously is going to be part of the daily routine moving forward. So having employees wash their hands before work or before they arrive, or upon arrival, I should say, during the day, upon bathroom breaks, and at the end of the day. So you'll have to have a frequent hand washing and some rules about how they should wash their hands. And finally, limitation of equipment sharing. Or guidelines where it's not possible. So prevent as much as possible. Equipment sharing is really the best practice right now. But at the same time, if you have a photocopier, you're going to only allow one person to use the photocopier, and then you have only one person who's able to access it. Or is there maybe a requirement to disinfect every time using it? Communications. So communications is one of my personal favorite areas of consideration. I can never understate the importance of communications in pretty much all human resources areas, but in this one, it'll be really important. So there's never too much communication. That's what we believe. So bear that in mind as you go through. A recommendation, certainly not necessarily something you need to do, but a recommendation might be to survey your employees. Just find out how they're doing. This is a real transition for people. It's a time of great uncertainty. So it could be nice when you're thinking about bringing people back into the office, to find out how they're doing and to get their ideas and feedback. Communicate before, during, and after. So we always see, or often see, I should say, that employers will, do a great job of communicating their new memo or their new policy, but maybe not consider that you want to do a numbered, several iterations of that communication, or several communications. So let's tell them we're planning to do, to bring them back to work, and that this is the day, and they'll get more information. And then say, we're going to do a training, and the training is going to be on this day, and we're going to share it all with you. You can have an approach to the communication. So putting together a really nice communication plan. And don't forget about communications during and after. So we often see the communications are done ahead of time, but then there's kind of a stopped communication. So don't forget how important it is to communicate during the transition back to work, and then once employees are, I don't know if settled is the right word, but are getting back to the swing of things. Allow for questions and feedback is always a great approach to build engagement and trust with your employees. Frequent check-ins, and tied to the frequent check-ins is the use of formal and informal channels. So bear in mind that, you may want to send a memo, but have your managers pick up the phone and call the employees, or do, texting, or whatever channels are best and appropriate. Do make use of many of them, just so your employees are feeling cared for and nurtured during a difficult time. The health and safety, the occupational health and safety websites have a plethora of posters. And so we encourage you to get access to those posters about hand washing, physical distancing, keep up with those requirements, and you can post them all over the office. And that'll be a way that you can ensure that the employees are validating or are following the procedures properly. And ensure that your policies are easily accessible. So let's not just send them out by memo and then forget about them, put them on a shared drive or on a bulletin board or in a variety of places, just to make sure that if they can easily access them. There's a lot of changes that are going to happen. They're going to have to really, follow a lot of new rules. So let's make sure that they know what those rules are. Train your staff. So this is a fundamental and important point. It's part of, what is the requirement under your health and safety legislation. So make sure that your employees are aware of the new protocols for physical distancing. So do be certain that they know that they have a responsibility to stay apart from each other. So even if you put them, at 2 meters apart from on their workspace, that they also have an obligation to maintain their physical distance on a regular basis. The new hygiene guidelines in the process. So, as I mentioned, if you're going to be asking them to clean their workspace once a day, then, you'll have to tell them to do it and when to do it. You'll have to be specific in these rules. Let's not be vague. Completing the health questionnaire. So if employees are going to have to complete the health questionnaire upon arrival, you're going to have to show them where to find it, how to do it. You're going to have to, make sure that they're trained and aware of those requirements. Controlling, you'll need to tell them how to controlling the perimeter. So arriving and leaving the building, like how do they make sure? Do they wait until the first person goes in before they go in, etc. Proper equipment usage. So I mentioned already, the sharing of equipment. Train your managers first. Managers are your front line to making sure that that they can then in turn help their employees follow the rules. So do have a session with your managers ahead of time. Give them a summary of the disciplinary measures, for example, as well, just so that it's so that they can be there to answer questions. Give them an opportunity to ask questions first as well. It'll be really helpful for you. And remind your employees to be respectful. I mean, obviously, to be respectful about safety and health, to be respectful of their colleagues, and to be aware of their own requirements, but also to be compassionate. People are understandably in a it's a difficult or uncertain time, let's say, and so just not only do you as employers need to be aware of that for your employees, but also remind employees to consider that amongst themselves. It's also recommended in the point of training that you train your employees remotely before they go to the office or they go back to the work site. So do consider hosting a session like this one, a remote session, a webinar of sorts with your staff so that they're actually aware of what those protocols are before they show up at the office on the first day back. And that's obviously for those of us who are still working from home. Those of you in essential services maybe are bringing more people back. Mental health is a factor that you will want to consider in your return to work planning. And so, do expect uncertainty. As we mentioned, it is a place of uncertainty right now. There's a lot of unknowns. There's a lot of changes. The world is in an adapted place. So expect that employees will be a little nervous right now and make space for that. You can validate the access. You may have an employee assistance program, or you may have an employee and family assistance program, benefits programs that may offer some support. There may be some resources available. So do consider all of those resources and try to ensure that you circulate that information or provide access to that. Remind employees about the importance of self-care. So in a time when there's all this uncertainty, it can be relieving to have an employer just mention, take care of yourself. That in and of itself can be useful. Keep in contact with your employees. So thinking about those employees who may be working from home. If some employees are back at work and others are working from home, don't forget those employees at home. Or what about those who are staying at home due to their health circumstances or childcare or what have you? So do think about that. Pulse check. So a pulse check is when you do a quick check-in with employees. So maybe just like validating how they're doing. Pulse checks is a really nice way to see the status of your employees' mental health, or you don't want to ask any private questions, but just to see how people are doing. And you can do this just with a survey, or you can have your managers asking. There's a variety of ways to do it, but a pulse check can be a nice way to just get the vibe of the people. We've already mentioned the need for flexible policies right now, and this is really useful not only to meet your health and safety obligations, but also to manage your employees' mental health, so they can feel like they're being taken care of. And a last point about mental health is don't forget your managers. Managers are under a lot of pressure. They're both feeling all the same feelings as the employees when it comes to the uncertainty, but at the same time, they're taking care of trying to, compliance and making sure the rules are followed and making sure that operations are back. So do really think about your managers in mental health as well. Finally, monitor and adapt all of this. So, there's a lot of change, and you'll implement a lot of policies. So you want to make sure that these are the right policies and that it's going well. So meet with, your committees and your management frequently to see how things are going. Is it working? Are there changes needed? Stay informed. We mentioned this already, but do stay informed with public health, local legislation, occupational health and safety, and the news. So do keep all of that in mind. Revise and update based on these evolving guidelines. monitor to ensure that protocols are respected, and take action if they're not. It's all fine and well to have a health and safety policy, but if it's not respected, then you're not actually doing your job as an employer. So you do need to ensure that these protocols are respected. Monitor how your employees are doing. I already mentioned that. Monitor the office activity and adjust as needed. So if you are finding that people are starting to show up to work all at the same time, you're going to have to make an adaptation. Be receptive to your employee feedback. Employees have a great stake in this, and so it's really important to hear them. And also they have some great ideas, so do be aware of that. And finally, be flexible, be agile, be adaptable in a context where uncertainty is the only certainty. So some final thoughts before we turn to the Q&A. To summarize all of that, let's just make sure that we're prepared. So think it through, do a risk assessment, take a look at the policies you need to put in place, make sure that you know what's going on, and be prepared. Prioritize safety. It's your obligation as an employer, but it's also just the right thing to do. So, do be aware of it's a tough world out there. It's a pandemic. We've never seen anything like this. So do prioritize the safety and well-being of our employees. Communications, as I mentioned, we can't underscore the importance of being communicative with your employees and how important that will be in ensuring that the return to work is not only safe, but productive and good for everyone. Finally, be flexible and compassionate. The best practice for employers to be flexible at a time of uncertainty. So that was our presentation for today. Just before we open up the Q&A and Lila joins me to start, I see a few questions up there have come in. I'm not sure if they've been answered yet, so Lila's going to let me know in a moment, but I will just mention a couple things. So first of all, there is another webinar next week. So we're looking forward to seeing you then. It's going to be a more open Q&A. So in case we don't get to all your questions today, we will have an opportunity to continue to answer them. But also, if you are interested in receiving the checklist that we produced for this webinar today, just contact us. So my name and email and contact info is on the screen, as well as Lila's. And you can always visit us at borealamanagement.com. And so we'd be happy to either answer additional questions or to provide you with the checklist as well. So Lila, I don't know if you'd like to join me now and let me know if there are any questions that we should answer.
Perfect. So there are quite a few actually. The first one is I have one employee who has a medical appointment in Manitoba, and Ontario has required that that person be self-isolated for 14 days. Mm-hmm. As an employer, do I need to accommodate with full pay during this time?
Well, that's a great question. So generally speaking, and I would say that there's a few things you would need to validate first. So you'd have to validate against any current policies, collective agreements, and local legislation. So if you're an Ontario employer, you'd need to validate against Ontario labor standards. But in general, if an employee is not working, you do not need to pay them. Again, I want to say that just with qualification, because it will depend maybe on your industry, but also if you have a policy already in place. So those are some considerations, but so broadly speaking, probably not.
Okay, perfect. Similar question about the medical appointments. If there's an employee who's attending a funeral in a town that has positive cases, this person will need to self-isolate upon the return to the community. Will they need to provide full pay if this person's not able to work from home? So I guess it's a very similar question.
Yeah, it's a similar question, but it is a great question. So you can kind of build on that. So whether you basically you can, again, I can just say that you would need to validate all of the things I already mentioned. So, policies and so on, labor standards, but in general, there are few circumstances where you are required to pay your employees. There might be some sick leave requirements and so on, again, depending on your jurisdiction.
Perfect. If the employer has the obligation to provide medical grade masks and sanitizers, et cetera, and there aren't enough supplies to fully supply each employee with them, like for example, the masks, what happens? Does the employer still need to offer each employee this personal protective equipment?
Yeah, that's actually an excellent question. So I think that might be one that we come back to. I'll say what I believe at this moment, but I think we might want to research that just a bit more to make sure that we're guiding you appropriately. But generally speaking, if you are requiring your employees, you need to provide it to them. I believe that there are some ways that depending on the type and the type of protective equipment that you're providing, that there is some ability to reuse. But at a certain point, if you're not able to, what do you do there? So I think that we should come back to that one, Lila, unless you have anything to add on your side that you're aware of.
No, I think we should, yeah.
Yeah, but I mean, obviously in the medical industry, if they're not, they're still working and they're still, as an essential service, they're still continuing by reusing things and so on. So, but again, it's not advisable. So start sourcing now is really the best answer for that. Mm-hmm. I want to add something, if I may, my apologies, to the last question as well. I just wanted to add that you may choose to pay your employees, however. That's just something maybe whether or not, what is required by law is one thing, but what you choose to do as an employer as a best practice, bear that in mind as well. You might choose to pay your employees while they're off. But again, that'll really depend on the type of employer that you are and, what kind of competition you have in terms of attracting and retaining employees and so on.
Okay, the next question we have is, how would you rate the likelihood side, say on a scale of 1 to 5, of the risk assessment equation if your organization has 0 confirmed cases?
Well, so I think when we're talking about risk assessment, it's not so much, it's obviously very low in that case, like a 1. But I think what the purpose of the risk assessment is more about are you ensuring, because people will be able to go out and meet other people and they could potentially have a case and not know it, right? So it would be a good idea. So the purpose of the risk assessment is actually just to make sure that the work environment prevents the spread of any possible contamination. So your obligation as an employer from a risk assessment perspective is actually to say, okay, are my workspaces distance apart? So whether or not people have COVID right now is not so much, and I hope I'm answering the question properly, but it's not so much your concern. It's actually just to make sure that, even if your employee goes out and ends up, just because they go to the grocery store, unfortunately, contracting COVID, that your workplace is still protected and safe. That is your obligation. I think you're on mute, Lila.
Oops. So the next question we have is if we can be more specific on travel and quarantine. So when being in Quebec, there are many hotspots. Is it recommended that employees self-quarantine if they're traveling to those hotspots? Are there other standard recommendations?
Yeah, that's really good. And that's one where you're going to have to also really keep up with those public health requirements, because now they are just in Quebec, they are opening up the travel at this moment. So are we going to have to quarantine people just because they go to Montreal, for example, and where are those hotspots? I think that at this moment, what I am really thinking about this one, because it's true that until last week, if you did go to Montreal, you absolutely would have to isolate in Quebec, for example. So whether that has changed in the last couple of days because they have opened up the travel is something I think we should come back to as well next week. And I believe that given the fact that travel is open, it is not a requirement, but I'd like to double check that one.
Perfect. And then we have one other question here about in being a compassionate employer and managing staff differently. Do you have any ideas on how to manage resentment among staff and employees are no longer being treated fairly or equitably?
Yeah, this is really, really important, and it comes up a lot. So I don't know if the situation that the question comes from, but if some employees are essential and others are not, or some can work from home and others can't, there is definitely that sense of equity. There may be some resentment. I think the broadest thing you can do is communicate, be, appreciative and thankful. In some cases, there are some, again, this is really specific to a circumstance, but there are some considerations that some are offering in terms of like actual recognition of wage increase or a certain premium for essential service workers. Depends on your industry and whether that's required. But another thing you can do is really just recognized through some kind of, whether it's a gift of some kind, like a credit, or there's many things you can do that are that can show gratitude that are not financially debilitating, a gift card or something like that. But most importantly, I think the answer that we would normally give is communications. So take the time for those people who are feeling resentful to hear them out and have a discussion with them and find out the source of their resentment. And sometimes that can help find the solution. So someone might say, it's just not fair. I haven't been able to, I'm just really tired. I'm exhausted from all this. Maybe that's more their source of resentment and not so much like it's simply not fair. So to me, I think one of the best things that you can do is really just communicate and hear them out, find out why they're resentful.
Okay, great. Another question we have is, can employers force you back to work? What are the measures you can take as an employee to ensure they are following current health and safety guidelines, and what happens if they are not following those guidelines?
Okay, so that's a two-part question. So the first is, can you force employees back to work? And the answer is actually yes, you can. There are obviously some circumstances that you obviously can't force somebody back to work if they have COVID, but or if they're feeling ill in any way, if they are excluded for all the reasons I mentioned earlier. But another thing you have to consider, you can't force somebody back to work if they are concerned, if they feel the environment is unsafe, then you would have to do an investigation. Another factor, reason you would maybe not force somebody back to work is if they have some accommodation requirements, in which case you would again need to review what the accommodation requirements are. But if somebody just says, yeah, I don't want to come back to work because I am nervous about the environment, I'm feeling uncertain about the world generally, or I don't want to use public transport. In fact, you are the employer, and you're under no obligation to permit somebody to not come into the office. But again, be careful and be considerate, and be aware that it probably will come up. The second part to that question, remind me again, Lila.
And what happens if they're not following the guidelines?
So if they're not following the guidelines, that's when you'll want to look at your disciplinary policy. So again, it will depend on the severity. So if somebody comes to work and they are quite ill, then that is a different case than if somebody maybe forgets to disinfect their personal computer one day, right? So you'll want to, so typically in your disciplinary policy, you'll have a 4-step process, most likely, to discipline, warning, verbal warning, written warning, suspension, and termination, something along those lines. So it will depend on the severity. But you can follow any kind of a typical discipline process. It will depend on the severity of what they've done.
Perfect. And what about some examples of non-compliance for non-compliance?
So some examples might be, again, like I just mentioned, that somebody shows up at work when they shouldn't. And that would be a pretty important one to make sure of right away. If people aren't following, if you have a situation where people are in a meeting room and nobody's social distancing or physical distancing, in that case, it's your obligation to remind them and to ensure that you take some steps. So do you need to give them a written warning the first time somebody is sitting, 1.8 meters apart instead of 2? Perhaps not, but a verbal kind of reminder is a good idea. So again, it will just really depend on the circumstances of your own business environment, your industry. In some cases, you're not going to be able to physically distance because maybe you're on an assembly line or that kind of thing. So, so you'll have to bear all those things in mind. But those are a few examples, I think. I hope those were useful ones.
Okay. I think we're getting near the end of the time, Tanya, but I just wanted to clarify one point. I think one of the on the Q&A, they were more talking about the the employer, not so much the employee, right?
For non-compliance?
That's right.
Okay. Well, great question. And thank you for that clarification, Terry. So for the non-compliance for the employer, there are some significant fines that you can be facing. So that will depend on your jurisdiction and your your industry and so on, more your jurisdiction. But if you're reported, you could be subject to fines, and if there's an investigation, and it will again depend on the severity. So similar to your employees, if your employer, as an employer, you will be, if you are, very egregious in your non-compliance, they can fine you quite significantly. Maybe if it's a small infraction, it won't be quite as high. But again, you'd have to check on each occupational health and safety or your employment legislation will have the specific fines. You can find them quite easily.
Yeah, well, okay, thank you very much, Tanya. One question that I had, and I'm just curious about, and is how would you, as an employer, handle sort of the, I guess, the toilet situation in terms of, how, certainly most communities will have just, maybe one or two men's, female, whatever, toilet, or maybe even one right in their office. So how would they handle that? Not only, obviously access, but also cleaning inside as the day goes on.
This is an excellent question. I actually wish that I'd included it in the presentation. So first of all, the first question will be, are they your own or are they a building? So like in our case, for instance, we have a shared bathroom facilities and individual, but most likely you'll require employees to disinfect. So to bring in some disinfecting agents will be the best way to ensure that, and maybe provide some rules about proper hygiene within the bathroom setting.
Okay. All right. Thank you. That's very helpful.
Yeah.
So certainly I want to thank all of you, Tanya, like Lila, and certainly Lindsay, about your presentations here. It's very much appreciated from Boreal Management. So we're going to bring again, next week, focus on human resource management, but I want to let you know that today's webinar, the recordings of the webinar will be on the AFOA Canada webinar page at www.AFOA.ca. There's a conference survey, so it'll appear after the webinar, and certainly ask you to fill that out. Now, next week, when we bring Boreal Management back, there's a couple things we want to talk. We want to pick up on this discussion because as the week goes on, you may think of other questions that you may want to ask. But then the second thing we want to talk about is they're kind of experts in crisis management as well. They've been having helping a lot of First Nation communities. And I think we learned a lot. We're still going through, obviously, the COVID-19 pandemic right now in much of our communities. But what we also want to do is start considering the potential of a second wave and ensuring that a lot of the lessons that we've learned this time is as well, sort of enacted for the possibility of a second wave. So certainly we'll be bringing Boreal Management back next week, again, next Thursday at 2 o'clock to present on this. And I just wanted to also use this opportunity to promote our new certification, which is the Indigenous Human Resource Professional. It'll begin the first cohort. We're going to be piloting here shortly on July 17th and 19th. So you could certainly sign up for that. We'll be obviously talking a lot about the COVID-19 and professional practice and that kind of thing. But there's also, sort of funding you could get from the National Indian Brotherhood Trust Fund right now that closes for individuals on June 5th. So you could certainly apply for that as well. So, certainly there's something that to consider. And again, thank you very much for your time coming out to our webinar series, and I appreciate all of the presenters that have presented today and take question and answers, and the AFOA staff. Thank you very much, and we will see you again next week at our fourth webinar. Bye now.